Well, many of the patients that are receiving the most care in any state are patients with complex conditions. They may have chronic diseases, they may have a number of comorbid conditions, and it makes providing care for them a little bit more complicated and often requires multiple members of healthcare teams. CT HealthLink and the data that's contained in CT HealthLink can help to coordinate that care, can ensure that what is provided by specialists is known to and understood by their primary care providers in ways that reduce uncertainties and the need for duplicative tests and procedures.
It improves patient safety because if the physician wants to order certain tests or start the patient on new medication, the patient will have the opportunity to have their safety protected because the physician will have the information as to whether there are concerns for drug-drug interactions, whether the patient has already had tests that the patient does not need anymore, whether there may be some cost savings for both the physician and the patient.
Yeah, this is actually a personal issue for me as I'm dealing with some family health situations and seeing the difficulty in moving information across providers, across facilities, and how that information blockage or the lack of access to it really does amplify risk for patients, where med lists aren't being transmitted, where tests are being repeated, where the information from one provider doesn't get to another provider who perhaps is providing emergency care and needs access to much better information in order to provide that effectively. That's where I see patients really benefiting from this.
Patients can expect better coordinated care and better care, more quality, because the physicians will know, all of their providers will know what is going on in their medical life. All of their data, all of their examination data from other providers will be in there for examination and consideration when their care is being determined. So patients should expect more efficient care, more quality-directed care, and more complete care through this.
The other thing is that it would allow the patient and the physician to communicate better. The physician would be able to send information to the patient. The patient would have access to their test results, and there would be able to be communication back and forth between the patient and his or her physician.
Among the concerns that people have raised are concerns about privacy, which are critically important, and the fact that patients do have the opportunity to opt out of CT HealthLink and do control the information that is maintained in their portal is very important.